Hello everyone, this is Syed Sagheer Ahmed. In this video, Antiarrhythmic drugs part 2, I am explaining the mechanism of action of different class of antiarrhythmic drugs. This video is the continuation of my previous video, that is Antiarrhythmic drugs part 1, where I have covered definition, causes and types of arrhythmia, conducting system of the heart, cardiac action potential and classification of antiarrhythmic drugs. Before watching this video, please do watch my previous video. So let's get started. Now let us understand the mechanism of action of class 1 antiarrhythmic drugs, that is membrane stabilizing agents. It is also called as sodium channel blockers. Before that, we will see the different states of sodium channels. This is a sodium channel in a resting state or a closed state. Here you can see it is closed. It is a sodium channel in an open state where there is an influx of sodium. This sodium channel is in inactivated state. Here channel is opened but not activated. Activation gate is closed. All class 1 antiarrhythmic drugs block sodium channels and prevent entry of sodium into cardiac cell. Sodium channel blockers usually bind to sodium channels in the open and inactivated state and interfere with the contraction or depolarization of heart. Let's move to class 1A antiarrhythmic drugs. Example, quinidine. Quinidine is an alkaloid obtained from cinchona bark. Class 1A drugs block sodium influx into cardiac cells and depress phase 0 depolarization or contraction. Usually in case of normal rhythm, there is an influx of sodium in phase 0 resulted in the contraction of heart. But class 1A antiarrhythmic drugs block sodium influx and interfere with phase 0 depolarization. These agents also block potassium ion channel. During normal cardiac rhythm, opening of potassium channel leads to efflux of potassium and resulted in repolarization or relaxation of heart in a faster way. But class 1A drugs prolong or increases relaxation time by blocking potassium channels. Now the action potential is changed to this. So what difference you can observe in this action potential? Due to the blockage of sodium ion, cardiac cells are less excitable. That decreases automaticity. Automaticity is the ability of cardiac cells to generate its own impulses. Decreases excitability. It is the ability of cardiac cell to excite in response to stimulus. Decreases conduction velocity. Conduction velocity is the speed of conduction of impulses. Finally, if we observe here the time between phase 0 depolarization and phase 3 repolarization is increased, or we can say the time between contraction and relaxation is more, so heart is slowly beating. Hence, effective refractive period is increased. Class 1B antiarrhythmic drugs block sodium channel preferably in inactivated state than in open state. They are having minimum effect on phase 0 depolarization. Example is lignocaine or lidocaine. It is a local anesthetic drug. It depresses the electrical activity of arrhythmogenic tissues, or we can say the tissues which are involved in arrhythmia, with minimal or no effect on normal tissue. It also reduces automaticity of ectopic foci by reducing the slope of phase 4 depolarization. Ectopic foci is an excitable group of cells present in atria or ventricles other than SA node that causes a premature heartbeat. Class 1C drugs are potent blockers of sodium channel, preferably in an open state. It depresses impulse conduction and causes broadening of QRS complex. QRS complex represents contraction of ventricles or the lower chambers of the heart. Class 2 antiarrhythmic drugs are beta adrenergic blockers. Example is propranolol. Propranolol binds to beta adrenergic receptor in the heart and block its action. That leads to decreased automaticity. Automaticity is nothing but the ability of heart to generate its own impulses of contraction. It decreases excitability. It is the ability of cardiac cells to excite in response to stimulus. It also decreases conduction velocity, that is, the speed of conduction of impulses is decreased. Propranolol also depresses the slope of phase 4 depolarization or contraction. It also depresses SA node. As I told you in my previous video, that is antiarrhythmic drugs part 1. SA node are the specialized mass of cells present in the right atrium near the opening of superior vena cava. SA node is having ability to generate impulses of contraction that leads to the contraction of heart. Sometime there might be an unnecessary and recurrent generation of impulses from SA node that leads to arrhythmia. In this case, depression of SA node may be helpful to manage arrhythmia. Beta blockers also shows a beneficial effect in treating supraventricular arrhythmia. In supraventricular arrhythmia, there is an abnormal heart rhythm above the ventricles. It involves SA node, AV node and atria. Class 3 antiarrhythmic drugs are potassium channel blockers. Example, amiodarone. Amiodarone block potassium channel and inhibit the outflow of potassium ions from the cardiac cell. This causes decrease abnormal automaticity. It prolong or extend phase 3 repolarization or relaxation. It prolong the duration of action potential by increasing the duration of effective refractive period, that is E or P. ERP is the distance between the duration of phase 0 depolarization and phase 3 repolarization. If the duration of ERP is increased, the time between contraction and relaxation of the heart is increased, and by this unnecessary and recurrent conduction can be avoided. Amiodarone also blocks sodium channel in inactivated state. It is also a weak beta adrenergic receptor blocker. Class 4 antiarrhythmic drugs are calcium channel blockers. Example, verapamil. Verapamil inhibit the influx or entry of calcium ions into the cardiac cell. That leads to decreased calcium mediated P4 depolarization or contraction, decreased contractility of the heart, decreased automaticity, decrease conduction of atrioventricular node, and increases effective refractive period of AV node. It is useful in the treatment of paroxysmal supraventricular tachycardia (PSVT). PSVT is a rapid heartbeat occurs when the normal electrical impulses of the heart is disturbed. Usually it occurs above the ventricles or the lower chambers of the heart. By administering calcium channel blockers, arrhythmia can be managed and it can be treated.